On Monday, the CDC announced major changes to the childhood vaccine schedule. The original vaccine schedule had 17 immunizations, while the new one only has 11. Akron Children's Chief Quality Officer, Dr. Michael Bigham, is back today to talk about these changes. Let's take a look at how the new vaccine schedule works. There are three categories: immunizations recommended for all children, immunizations for certain high-risk groups or populations, and immunizations based on shared clinical decision-making. With the new schedule, how will doctors navigate what's best for their patients and what the CDC is recommending?
Well, that's a great question. Thanks again for facilitating this conversation. I think what's important to know is pediatricians for decades have been talking with families about where vaccines can be helpful and why vaccines are needed. And I don't expect that to change. I think that conversation is a really important part of that patient and family provider relationship.
Some of the vaccines that have been removed from the recommended for all children schedule are flu, RSV, and hepatitis B. There are more, but I want to focus on those three specifically. When we talked last, you had said that vaccines should be tailored to the public health needs, and recent data from the CDC is estimating that there's been 7.5 million illnesses, 81,000 hospitalizations, and 3,100 deaths from the flu this season. How is the decision to remove the vaccine recommendation going to impact our community health?
Well, what we hope is that when patients get a chance to talk to their healthcare provider, that the noise from social media and opinion pieces are set aside, and they're really just frank, honest, scientifically informed conversations between a patient and the family and their healthcare provider. I expect the result of that conversation will be the result of those conversations for many years, which is the evidence supporting the value, in this case, of the flu vaccine in preventing flu illnesses, but also preventing the most severe consequences of influenza infections.
The CDC reports RSV is the leading cause of infant hospitalizations in the U.S., but the RSV vaccine is only recommended if the mother did not receive the vaccine or if a child's at high risk between 9 to 19 months. Is the effectiveness of the antibodies from a mother enough protection?
When the mother receives the immunization, there absolutely is immunity conferred upon the baby. That's good. That's great. That's better than nothing. I can tell you that the infant vaccine, if the mom does not receive the vaccine, is very effective. There was a time, even 4 years ago, 5 years ago, 6 years ago, where our ICUs and our hospital wards were filled with little babies less than a year of age with RSV infections. And that's just not the case for those kids who've been immunized, either the mother's immunization or, even better, the baby's immunization.
Hepatitis B rates dropped 99% after the universal birth dose was introduced. And for those who might not know, why has hepatitis B vaccine been recommended for so many years, and how does it impact children, and is it a big risk?
Sure. So there are instances of adult hepatitis B where the mothers are unaware that they have that infection, and then they can pass that on to their babies. When that hepatitis B vaccine is given in the newborn period, that significantly reduces the likelihood of that infection setting up in the baby.
How do you think all of these changes to the vaccine schedule will impact parents, doctors, and public health overall?
I think it's confusing for parents. I think what I can only hope is that the conversations are had with healthcare providers, allowing families to sort through the confusion and really get to an area where they're very comfortable, where their trust in their healthcare provider and their trust in the sort of longstanding evidence of vaccine safety on the impact on child health is sort of comes clear in that conversation. And then I think the families will be very comfortable making the decision to give those vaccines for their kids.
Well, Dr. Michael Bigham, Akron Children's Chief Quality Officer, we appreciate the time and the expertise.
Thank you so much. Have a great evening.